I witnessed in a primary school a 7-year-old having to be locked in a classroom because he was rampaging around with various items attacking pupils and staff. There's a reason why, on average, every month since I became an MP, just over 2 years ago, I've raised the issue of children's mental health, including in my maiden speech. It's because from the moment I got elected, I have had a relentless stream of parents and carers and young people coming to me, often waiting a year or more, if they're very lucky, 6 months, but more likely a year or more to access desperately needed support. Because behind every number that we have heard today, there is a child who is struggling to do everyday normal activities that every young person should be able to do, or tragically taking their own lives, as happened with a Year 11 pupil in my constituency last year, and parents who are tearing their hair out. The tragedy is, if we could intervene earlier, we wouldn't end up with so many children in crisis. Local head teachers just say they are overwhelmed. They have seen a 50 to 100% increase in need since the start of the pandemic. They're buying in additional support, but their staff can't cope with the volume and the complexity of need. One mother came to see me a couple of weeks ago, and her 15-year-old was referred in 2019 for anxiety. She's still waiting for treatment, and now her needs are so much worse. And therefore, she's got to go to the back of the queue for another waiting list for tier 3 instead of tier 2 intervention. Is this acceptable today for these children? And yet so many primaries I speak to are relying on parental fundraising and donations to pay for mental health support. Madam Deputy Speaker, it's no exaggeration to say we need a wartime effort to tackle this crisis. We need a trained counsellor in every school. Surveys have shown they want to do more work, so there is workforce capacity there, as well as community mental health hubs and more specialist provision. We owe it to those children. Yeah.